Professor Marso, at the ADA in San Diego, the results of the DEVOTE trial were presented. Can you summarize them for us?
Sure. So DEVOTE was a very large cardiovascular outcome trial of patients with type 2 diabetes who were at very high risk for cardiovascular events. We enrolled over 7,600 patients, and they were randomized in a blinded fashion to either insulin degludec or insulin glargine. We followed the patients for about 2 years. Now, there were two objectives. One was to establish that degludec was as safe as insulin glargine from a cardiovascular perspective, and the second was to test whether it was as safe as or safer than glargine with respect to severe hypoglycemia. So with respect to the first question, is it as safe as with respect to cardiovascular outcomes, it clearly was. I mean, the hazard ratio is 0.91. There were numerically fewer cardiovascular events in the patients randomized to degludec, but it didn't reach statistically significant, so I think it's the same as or safe as. With respect to severe hypoglycemia, degludec was superior to glargine with respect to severe hypoglycemic episodes. Now, in DEVOTE, we used the ADA definition. We adjudicated severe hypoglycemia, so we were pretty confident that these were clinically meaningful hypoglycemic events. So I think those are the two main takeaways from the two findings. You know, there's a 40% reduction in severe hypoglycemia and over a 50% in nocturnal severe hypoglycemia.
Okay. Given that hypoglycemia and cardiovascular events are sort of connected, or speculated about that, could you explain why with a reduction in hypoglycemia there was no reduction in cardiovascular events?
Sure, so it would be really speculative for me to say for sure, but I think that there's clearly an association between severe hypoglycemia and cardiovascular complications. And it may be that in a frail, high-risk population, actually it precipitates important cardiovascular events, and that's probably true. But there are so many other causes of cardiovascular complications in people with diabetes that it's going to take a very focused analysis for us to figure out if there's an interaction between prevention of hypoglycemia and cardiovascular complications. So I think stay tuned. I think we're going to look at this, and we may hopefully have more information at Lisbon at the EASD. It's certainly a top priority of one of our sub-studies.
Even more speculation, can you speculate what would have happened if we used glargine U300 instead of the U100?
So it's hard to know because you'd have to do the clinical trial, but my sense is that it would be very similar findings to what we found now. I mean, I think the two molecules are very different, and the half-life are different, and their variability is different, and my gut feeling is we would have found the same finding, frankly. But it's speculative because we didn't use U300, as you know.
Okay. Thank you very much.
Yep, you bet. Thanks.